Mothers suffering severe nausea, vomiting, and weight loss to the point of being incapacitated might have a more serious condition than just morning sickness. Catherine Clark is a registered nurse and a member of the Texas Medical Association. Catherine, thank you so much for joining us to talk about this.
Thank you for having me.
It is a condition I'm just going to say is called HG. Tell us what that is and why is it so serious?
Yes, so Hyperemesis Gravidarum, or HG, is a severe form of nausea and vomiting during pregnancy. This can lead to dehydration, electrolyte imbalance, weight loss of at least 5% of pre-pregnancy weight. And this is a severe condition that often pregnant patients feel immediately around week 5.5. So it starts very early in pregnancy.
And you have a personal journey on this. When did you start experiencing all this and what were you going through?
I do have my own experience. I started having these symptoms right around week 5.5, week 6. The nausea and vomiting, the inability to really do my activities of daily living. I couldn't really get out of bed. I could not take care of myself. So between week 5.5 and week 10, I lost 18 pounds. So in a 4.5 week period, I was losing weight instead of gaining weight.
How dangerous is that, Catherine?
It's very dangerous for the mother, but also for the baby. You need as many nutrients as you can throughout your pregnancy so you can get to a point to where you and the baby are healthy.
So tell us why the Texas Medical Association is raising awareness about this now and what your role is in that.
Yes, so the Texas Medical Association established a new policy to recognize Hyperemesis Gravidarum as a severe form of nausea and vomiting during pregnancy, because recognizing it early on for these patients is so important so that they can have some sort of healthy, normal pregnancy so that they are close to baseline, so that they can function, they can get around, they can prepare for baby. So by recognizing this and establishing a new policy, but also developing a continuing medical education course, as well as a Hyperemesis Gravidarum Awareness Day, which is May 15th, can help spread that awareness so that more clinicians are aware of this, because patients really present in the emergency room so early on, and that's when it needs to be taken care of.
And that leads to my next question. It's not just raising awareness for mothers to be, but for doctors. And of course, that leads to earlier treatment, is it right?
Yes, that's correct. At least earlier treatment, which really is of fluids and nausea medication, both safe for the mother and the baby. And this will help you get to a point where you feel like you will get through this. Okay. There are so many times that I felt that either myself or both of us were not going to survive. So it's a very, very debilitating condition. And the most important thing that you need to recognize is to listen to the patient. When they're coming to you with these symptoms, you need to get them to the hospital, to their clinician, so they can get adequate care.
But those are also morning sickness symptoms. So at what point do you recommend a patient go seek professional help?
Whenever the patient just feels like I cannot function, because while morning sickness is still very uncomfortable, it is something that you can still eat small meals, you can drink fluids, you can function, you can go to work. You might not want to do these things, but you can still function. Whereas a patient with HG, any kind of stimulation, whether it be touch, taste, smell, anything can really exacerbate these symptoms to where you cannot take care of yourself. You cannot get out of your bed. You cannot eat. You're not eating for days, weeks. You're barely able to drink fluid. So once you recognize that, get them to the emergency room, but also try to contact your primary care or your obstetrician to let them know this is what's going on. I'm losing weight. And there are infusion clinics available where you can go and you can get this care, sometimes every couple of days, to get you to a point to where you are at a baseline where you feel comfortable.
We're running out of time, Catherine, but tell us, you said infusion center. What does treatment include? You mentioned anti-nausea medication, and we all know about that, but what is the infusion center?
It's just a center where they do other medications for other patients, such as blood transfusions or antibiotics, and you can go and you can receive fluids and nausea medications, and you can feel better.
I'm so sorry you went through that for all the women out there who went through hours, days, weeks at a time, not just for a short period of time. It was
HG lasts 24 hours a day for almost 9 months.
That is crazy.
It is.
Catherine Clark, thank you so much for joining us to raise awareness about this. Hopefully it'll help a few people out there.
Yeah.